And that's Script, this e-learning project, so the standardised computerised revalidation instrument for pharmacology and therapeutics, something that in fact, well, lots of people have been involved. Principal investigator, Professor John Marriott, is obviously involved, but I'm going to hand over to Sarah, who we were very fortunate. I think the best thing that's come out of Script really is that we managed to employ Sarah as our content and editorial manager. He's now doing research with me, but we'll take you through the programme. We were told to be a little bit interactive. It's a bit difficult, so we're going to show you some of the videos or whatever else, but I do want help, particularly those who are involved in early bits of the programme. So about halfway through, we're going to try and work out how this gets embedded in the undergraduate curricula, and so therefore I want to just spend a couple of minutes just perhaps gathering information from others to try and work out how we can get it working more so here in the college.
In 2009, the GMC commissioned a study to look at prescribing errors, and they looked at 19 hospitals in the northwest of England, looked at the rate of prescribing errors amongst Foundation Year 1 and Foundation Year 2 doctors, and looked at the rate of errors for those people. And if they did have, make a prescribing error, they asked them why they made that error. What do you think led to that error? That study found that F1s prescribed an error rate of 8.4%, and F2, so Foundation Year 2 doctors, prescribed an error rate of 10.3%, so actually slightly more than Foundation Year 1 doctors. The GMC report said that practical prescribing should form part of postgraduate education, and that trainees should receive feedback on their practical prescribing skills. So, the NHS West Midlands then set aside some money to commission the development of an e-learning programme. And their aims were quite clear. They wanted to ensure fundamental competence in prescribing, they wanted to reduce medication errors, and they wanted to make prescribers safer and effective and rational. So, a team of handsome people from the University of Baston, but first of all was where John Marriott was at the time. John Marriott as PI got together with Warwick, David Davis and Jamie and Professor Ferner here, and created the team which created Script. They put together a tender to say that we would create 40 e-learning modules in 12 months. I'm sure it was 18 months before, but then it all went a bit wrong. We had to do it in 12 months. And John won the tender, or the team won the tender, and we're given just over £450,000 to do the project. And we were commissioned in 2009. At this stage then, we had the money and thought, okay, we need to create these 40 modules. Let's decide what we need, what modules do we need, what do the Foundation Year 1 and 2 doctors need to know, what kind of errors occur, and how are we going to deal with them. And then we found different areas of prescribing. So principles of prescribing, actually basic principles about documentation, about prescribing an infection. Prescribing in medical emergencies is just something the Foundation Year doctors do a lot of. Managing the risks of prescribing, such as adverse drug reactions and drug-drug interactions. So we found actually that the subjects of prescribing all fitted well into 7 categories. We then took those down into modules areas. So, for example, in the principles of prescribing, we have all of these modules, and I can see the authors of the Fundamentals of Pharmacology module in there as well, in here today. So we got together then specialist healthcare professionals across the UK. So these are just some photos of people that would give me their photos, but not all there. We had over 80 authors and over 40 peer reviewers working on the content for the 40 modules. So it was a big task to coordinate all of these authors, get all the content in. The module authors were told to write for F1 and F2s, so to have them in their mind when they're talking about the prescribing. We wanted to provide background pharmacological knowledge to them, because that's in some ways missing in their undergraduate degree, as found from the GMC report. We wanted their learning to be scenario-based, so it was secondary care, which is where the F1 and F2s predominantly are, and we wanted the case vignettes, the learning that we provide, to actually reflect the kind of scenarios they see in practice. We wanted to have pre-post test functionality, because we wanted to find out what they knew at baseline, and allow them to monitor their knowledge acquisition as they complete the module. Also, we had some formative assessment for some fun and to make it interactive. Halfway through the project, the deanery then said, please can we have certificates? And so we then created certificates for the programme, so that one module completion, the users would each get a certificate to say the learning objectives that they've achieved. The certificate does not say, though, that they are competent to prescribe in that area, so we're unable to do that, obviously. So, safeprescriber.org script was born, and the first modules were launched in October 2010. This is the website, so it's at safeprescriber.org. It's online, web-based, so anyone can access it. NHS trusts, you can access it, but they can also access it at home. It works on the iPads, I've tried. And the modules are divided into 7 key categories that we came up with in the initial stages of development of the project. So throughout the module we have interactivity. We've used videos and audio to show things actually we'd find difficult to communicate in text, so using an inhaler. Dangers of potassium chloride, there was a lot to say on that subject, so we've used audio in that case so that actually the junior doctors don't switch off when they're learning it. And anticoagulation and taking a safe and effective drug history, which I'll show you. We also collaborated with the Ron Grimley Centre, so they've taken, they were funded by Health Education England to create some videos, clinical skills videos. There's 30 clinical skills videos they created for junior doctors, and they've allowed us to use any which are related to prescribing of therapeutics. So we have at the moment 6 videos embedded within the programme in different areas, and we're very grateful for them for allowing us to do that as well. And when we'd completed the 40 modules of scripts, the deanery decided that they should be mandated in the Foundation Years 1 and 2. So, in Foundation Year 1, they asked to do 16 modules, and they are mandatory. They have to do those between August, they're starting rotation and they finish. And they have to do so many of them by the time they get to December for their first review. Some NHS trusts actually mandate additional modules as well. So, for example, Russell's Hall Hospital mandate the prescribing in infection and infection secondary care modules, and actually mandate when they need to do them by. They do say at UHB that they must complete anticoagulation within the first 3 months of being there. So trusts are also mandating it as well. In their second year, they have to do a further 15 modules, and that can be anything they want, probably usually in relation to their rotation and where they're going. So if they're going into paediatrics, they'll probably do that module. We have a management system which sits alongside script, and this allows the progress of the trainees to be monitored, and it helps us engage with the trainees a little bit more and can help provide feedback. So when trainees register with script, they register with their clinical tutor. The clinical tutor then goes into the management system and can see the user, see what modules they've completed, their pre and post test scores. They can also see how long they've spent on the module. So if they did just click through just to get the scores, then we know why they've done that and they've done it. They can also look at a trust level. So they can look at a trust and see how they're performing in module completion, and actually look at how they're performing with their pre and post test scores as well. And again, some of the trusts are using the data that we have in order to inform their sequin targets. Because actually, if you're meant to provide education, for example, on VTE prophylaxis in the trust, and you've asked all your students to complete the module, then that's something that they're doing correctly. We allow postgraduate education centre managers access to the administration site, because we know that actually it's not always clinical tutors who are doing this, it tends to be the administrators who are following up whether or not they've completed their mandated modules. Early on in the project, when we only had 5 live modules, we evaluated what the F1s thought of it. And we realised that was quite early on, but we needed to do some evaluation during the project. So we did do a survey which we emailed out to all the trainees, and we just asked them what they thought of the toolkit. What did they think in terms of their knowledge acquisition? Did it improve their skills or confidence? And was there any perceived behavioural change from the trainees? We did have some positive feedback, so 80% of respondents agreed script has had a positive impact on their knowledge and skills. 88% found the module content relevant to their clinical needs. 65% agreed that it might change aspects of their clinical practice. Now, I think we only had about 18% replies on this, out of 1,200 trainees. But it was good for us to get an initial feeling of how well we were doing, what the modules were like, and actually also we asked them information about the interface, what's clunky about it, what's good about it. We also knew at this stage, when we asked them to provide free text feedback, that we knew that we were stopping errors occurring because people told us. So So there was one case, an example, after doing one module, I realised I'd made an error in converting a dose of lithium from tablets to liquid. I was able to contact the patient and correct the error. And this comment came up a lot about giving paracetamol at a normal dose for someone who's under 50 kilograms in weight, and lots of people gave free text comments to say that they didn't know that before they completed the modules. We did listen to feedback, even during the development phase of the modules. So we did reduce module length for some of them. We cut them in half if they seemed too lengthy, if it was taking them longer than an hour to do. We doubled the server speed. We got a brand new server because it was a little bit slow with all the users on it. At the time, the deanery couldn't quite decide which modules they wanted mandated. So when it was decided, that was all set in stone, and that made them a lot happier. Giving education centre managers access to the management side. And also we emailed clinical tutors automatically when the trainee had finished all of their mandated modules. So actually they didn't need to check on the system unless they actually wanted some more information now about providing feedback to the trainee. From a research point of view, we want to know the impact that this has had on the skills, knowledge and confidence and competence of prescribers. So we will be redoing an evaluation, but it's going to be a bigger evaluation this time. The current Foundation Year 2 doctors have completed the first and second year of mandatory modules, so they're the ones we want to know what do you think and how has it impacted on your practice. It may well be that we actually follow this up with some focus groups with the trainees. Impact on error is going to be difficult to prove. It's difficult anyway to get baseline data, and then it's difficult to compare. But that might come from qualitative information, again, from the kind of things that the students tell us about errors that they've prevented. And we have loads of data from this system, so every click that is made is saved. We know answers that are answered poorly. We know questions that are answered poorly and questions that are answered really well. So actually we know what the students' baseline knowledge is from the in-module formative assessments. And we're going to look at doing some research on that and hopefully get a few publications. We are expanding access. So at the moment, to begin with, it was West Midlands who had access to this. Now East of England and East Midlands use it, and they haven't set the mandated modules, but they're setting them in August, so they've kind of had a year's trial, if you like. And recently Wessex have taken it on as well. So from a UK Foundation School point of view, we're spreading across England at the moment, which is good and positive. And we're expanding access to the degree. So Postgraduate Dean allowed the tool to be bought with SIFT funding to allow access for the University of Birmingham. The University of Warwick, Keele have also taken it on, and we're currently liaising with Barts School of London, Medicine and Dentistry, who also want to take it on.